A full mouth reconstruction applies to where when just fixing one tooth isn't going to fix the problem. In many cases, that has to do with someone who's been a severe bruxer or grinder. So they've essentially shortened their teeth, not just one, but sometimes all of them, to where now when they close together, they're actually closing farther than they really should, which can, you can imagine if you didn't have any teeth, your chin's going to go to your nose, or it's going to go pretty close. And the reason is what stops us when we close are our teeth. So if you eliminate the teeth, now what's going to stop you is your gum line, or your gums from top and bottom, which means that chin is going to have a lot further to go. So a lot of times as patients start to lose a lot of tooth structure, they start to develop problems with their jaw. So where a full mouth construction comes in is that you're returning them back to, you're getting their opening back to where it should be. And that, kind of makes sense, is that you can't do that by just changing one or two teeth. Because if you just return two teeth to the original opening, now you have all the other teeth that aren't touching. So that's where a full mouth reconstruction comes in. And what that essentially means is you're crowning or restoring, whether it be implants or a combination of implants, crowns, bridges, that mouth back to what it was, close to its original state. Not only lengthwise, contour-wise, biting-wise, jaw position-wise. And that can be due to someone who's just had a lot of dental work in the past and is tired of having 6 or 7 fillings put in the same tooth. So for whatever reason they're susceptible to decay. Or you have to change the bite, or they're missing so many teeth, or they're missing teeth where they don't want a partial, they don't want a denture, they don't want something that's removable. But even sometimes in full mouth reconstruction cases, you are designing them to where some of the cases end up with a removable partial because they either weren't a candidate for implants or they just didn't want to do the implants. They could always come back later and do them, and we've had some patients that have done that. But a lot of it comes down to designing the case, returning the patient back to their original place where they had teeth that fully supported their face, because a lot of patients don't think about that. But as you wear your teeth, you get to a point sometimes where your teeth, when you close, you start looking like you're losing the lower third of your face. And that's just because the bite is collapsing. It's getting in, your chin's getting too close to your nose. And those are a lot of times the cases that we need to open back up and get the facial feature back.